So sometimes you get asked, how do I approach understanding what a patient wants for breast augmentation? Like, what's the outcome? And especially if somebody says they want a natural look. So a lot of this comes down to spending time with the person and really figuring out what they want in their words and what does that mean in my world in terms of sizing, what overall look they want. I usually recommend coming in with pictures of stuff you like and stuff you don't like. When you're thinking about sizing, you're thinking about two things: volume and then the profile. So how augmented or full at the top. So initially, some of the pictures will show volume, but the problem is if you take a certain amount of people and they all have similar body types, the same volume will look different in each one of those people. So just bringing in a before and after will give you an idea of what look you want, but it doesn't mean that if that person had a 350cc implant, that same implant will look the same for you. So making sure that that's clear, but getting an idea. Then when I size, I use certain kind of sizers, volumetric sizers, that we adjust. I put in a little bit here, I adjust it. I don't tell you what the volume is because I don't want you to focus on numbers, because most people have already done enough research. And then based on what you want and whatever cup size that ends up being, it's what you wanted anyway. And then we focus on the profile. This is where pictures of people kind of from the side in a low-cut dress or a bikini can give us an idea of how much fullness you want, what's augmented look or the natural look. And based on these, we can decide what profile. Typically, there's a moderate plus, and high profile, but there's also some in between and more extremes depending on what people want, what their body type is. So how I do it is I break things down to try to make it as simplified as possible and figure out volume first, then profile, and then we confirm it by another sizing. So I spend a lot of time with sizing because I think this is where the patient and me need to make sure that we're on the same page so they can be happy with their result.